Hello and welcome to the European Parliament. My name is Catherine Fiore and I'm delighted to invite you to this discussion on migraine. It's more than just a headache. We're here to break the silence of this very under-recognised condition. We've got excellent panel here. We have Dr. Patricia Pozos-Rosic.
Very good.
You are the head of neurology at the Vall d'Hebron Hospital in Barcelona.
That's
and
right.
Also the president-elect of the International Headache Society. MEP Catharina Martens, very well-known figure in this House, a very vocal defendant of women's health in particular on the Public Health Committee. And to my left here, we have Elena Ruiz de la Torre, Executive Director of the European Migraine and Headache Alliance, and also somebody who has personal experience of this condition. And finally, and certainly not least, Lynn Mandel, who is the Vice President of AbbVie for the Southern region. So without further ado, if I could just jump in here. Patricia, can you tell us a bit more about this condition clinically? What is it? What are the symptoms? How would you diagnose it?
So the first thing that I'm usually asked about is whether if migraine is just a headache or something else. I consider migraine a disease. It's a lifelong disorder that can start already in the pre-pubertal years, but childhood years, but especially in the adolescence years, which already conditions the decisions that you're going to make in your professional life and your personal life if you're already conditioned by this very debilitating disorder that doesn't allow you to speak, to think, to act on the days that you have migraine. And that's why it's considered the first most disabling disorder in Europe, not only for women, but also for everyone, and especially in these very teenage, young adult years where the condition starts and it doesn't allow you to perform your activities, your daily activities as you would want to. And then we have to think that migraine affects through life during all of the stages of a woman's health and different, I would say, hormonal situations. We have menstrual migraine, very debilitating disorder, under-recognized, and probably one of the factors that makes migraine more severely or affects more severely women than men. And then we have menopause, another very important moment in women's lives, where in the perimenopause, migraine actually strikes back again with very frequent and debilitating headaches again. And then finally, the last years of our lives, migraine doesn't really always improve, and it conditions also the last years of your life, making this, I would say, a very long road to live through if you don't have appropriate care and access to therapy.
So a lot of it is linked to hormones, but it's throughout your life, even post-menopause.
Yeah.
Elena, coming to you, could you say what, from your personal experience and from the many associations that you work with, how does this affect women's lives?
Well, it affects completely your life. If you have migraine, if you are born with migraine, because as Dr. Patricia Pozos said, it's a lifelong disorder, disease, and you are going to suffer it for all your life. If you are very severe, there's different severities, but if you are severe or very severe, your migraine is going to condition your whole life, your personal life, your working life, your social life, your family life. So there are so many moments in a normal life that you are not going to be able to be there because you will be hidden in a room or in a corner or waiting for this brain to calm down again and become normal. It's difficult. It's very difficult because also and one of the main problems that we have is the lack of understanding of our surrounding and our people. And it has a huge stigma. It has a huge stigma, and we prefer not to say that we have a migraine attack than to say it and find in front of us someone looking at us like, what is that? What do you have in your brain? Is that a mental health problem? Is that what do you are not normal then? And we are normal people, we can work. We need some support. We need treatment. I won't be able to be here today if I won't have a treatment. And I have been my whole life treated for migraine. And I have I haven't been able to do many type of works and not to be promoted in many occasions. And I have had so many difficulties in my life because of this, of suffering this condition, and the lack of understanding, I would say.
Lynn, would you like to say something about this, the social aspect of
Yes,
migraine?
I would say that even though you're not severely impacted, it has a tremendous effect on your life over time. And I've talked to many migraine patients, friends, family, and they describe all the situations that they avoid. And for example, in my own case, if I had a severe migraine disease, now I have only a light one, then I could never do the job I'm doing today. Traveling, different time zones, intense long days, being in a studio with this light, for example, this would never have been possible for me.
So, Katarina, I think you're the very best person to have here because you are, in fact, the reporter for the Public Health Committee on gender inequalities in health. And so this must be ringing a lot of bells for you.
Yeah, it's ringing a lot of bells, but now I was listening to you and I was thinking, well, maybe this is an example why when you fight for women's health and women's rights, you're fighting for everyone.
Yes.
Because migraine is understudied, as I understand, because I'm no specialist, so I'm here to try to put the best of the expertise of specialists on the decisions that we make at the political level. And what I understand, from what I'm reading, from listening to you, it's so good to be with such wonderful women learning about this, is that migraine is understudied. And also, treatments for migraine are not available for everyone. So we have a problem, we don't know enough, and what we know is not accessible for everyone that needs it. And then there's also a stigma associated with a condition that is considered a women's condition because it's more frequent in women than in men, but actually men also suffer. But for men to say that they suffer from migraine is even more complicated than for women because the stigma is even bigger. So maybe this is, this is like how we can explain that when we are fighting for a strategy for women's health, for more research, to end stigma, we are also fighting for health to everyone because stigma, it's terrible. In any place of society, in health is actually killing us. So we need to, we need to work on it.
On this innovation, on this diagnostic gap, Elena, you said that you've discovered that there is really quite a huge underdiagnosis of this.
We ran a survey years ago and we found out that there is people need at least 8 years to have a good diagnosis and a good treatment, or an appropriate treatment. As you very well said, now there is an innovative treatment that is working very well, and there is no access to it. So it's really a run in which you have to be looking for your own health, knocking doors, searching for information from others, from doctors. Nobody's going to inform you. You go to the GP doctor and they just say, well, this is just a migraine, that's not important. Or when I go to a hospital, whatever, and they say, have you had any surgery before or anything? And I say, no, I am a very bad migraine. And then they say, well, that's not important, I don't even write it.
Gosh.
Why not? That's what it is, the most important thing in my life. It's what it has conditioned my whole life.
Patricia, I assume that if somebody came with you, they would not be treated in that way. No. But what are the barriers? I mean, you're the head of neurology in a hospital. Is there a lack of trained doctors? Is there a lack of understanding? Can you get this information from your local family doctor?
Yeah, no, you're absolutely. What are the kind of hurdles that, she mentioned, very well said. The first thing is that it affects slightly more women than men. Number one, that already has created a lack of understanding or empathy towards what is happening. A woman complains about pain in her head. It looks like, it's like a joke. That's the first thing. The second thing is that I believe that there are no yet true biomarkers that are able to really put visible something that looks invisible. So we need to do more science. So the first hurdle is we need more investment, more financing to do proper research. We are, with very little funding in comparison to other diseases, we are already achieving a lot. If we would be given a little more, there are no calls that are focused on migraine, a disease that affects an 18% of women in Europe globally, 8% of men. So, I mean, whatever you're going to do for research in that regard, you're going to help an 18% of the European population. So more science, more biomarkers, very important because they will visibilize the disease. The second or the third thing, very important too, education. I fully believe that we should do educational programs already in the childhood and adolescent years. We are responsible for our health. Our mission in life is to take care of ourselves. If we don't know about diseases that are so prevalent that might affect us or our neighbor, our best friend, that doesn't help us either. So we need to teach about brain health already in the teenage years. Number 3, we need to educate physicians more. In medical school, there are only 1 or 2 hours dedicated to explain migraine. You know more about migraine than what many physicians do. It is a main cardiovascular risk factor. People don't know it. People think about hypertension, about cholesterol, about smoking. Migraine is a very important condition. Stroke and heart problems already in the young years of women. So that's another, medical education. And then I would say finally, I think it's just about taking care of what it seems, and maybe medicine is already mature enough to do it, what it seems as these non-communicable diseases. So medicine was very focused initially, because modern medicine started a century ago, on infections. We were dying about them. We still had a pandemic very recently. I mean, we need to take care of infections for sure. Then we went on to the heart, cardiovascular diseases. That has increased our lifespan. So the heart gives time, but the brain gives quality. And now it is the century, this century, the 21st century, is a century where we have to focus on more research on the brain. We need to understand the brain in many other health conditions, and we also need to understand the impact of hormones in our bodies. It is complex. Both things are complex. Both things need more technology. All of these new data-driven analysis that we're going to do, we need to be able to share data among the European countries to be able to make sure that this new we have to create new hypotheses that will come from analyzing in an unbiased way big data with new computational models. We are there, and Europe is prepared. We just need a bit of a push and an effort for this financing and education.
Lynn, coming to the economic questions around this, I'm just listening to Patricia and Elena, and I'm just going, why has it gone under the radar so much? And somebody said to me, well, it's because it's not a killer. You know, if it's just a chronic condition, you're expected just to somehow tolerate it for the rest of your life. But it doesn't get the same attention because it doesn't have that direct association.
Yeah, I've been thinking a lot about this, and I think Patricia said it very well. You know, it's women, it's seen as a headache, it's something you don't talk about. As Elena said, many people hide this from their employer and from others. So I don't have the answer to this, but what I can say is that if you look at the impact, because I love to hear about all the initiatives and all the list of things we could do to improve the situation. Of course, this will come to a cost, and I think that's many times also the barrier. We feel it's a huge patient group. Can we really afford to treat all these women and men? And I believe we can, because it's a huge potential the way I see it. This is, if you look at the working ages, women in working ages, it's a fifth of these women suffering from migraine, and 75% say that this has an impact on their working life. So it's the leading cause of disability among working women. So if you turn then that around, if we could just have a few percentages improvement, what could that mean? Normally, migraine impacts GDP in a country negatively by 1 to 2%. I looked for Portugal, it's 1.7% negative impact on the GDP. And in Portugal, you do a lot of very good things. So I can just imagine elsewhere. And the EU productivity loss, it's 27 billion due to migraine. So saying that there's a lot of potential in this, if we think about work productivity, and then if we think about also what I think this week we should do, the gender employment gap in the EU, 10%, and the competitiveness in EU, how many children are born in the EU, I can see only wins in investing in this field.
But I just wanted to mention one important thing, and she's very right, and you kind of said it too, which is what is the impact when a woman is sick in taking care, I mean, not only work, which we need a population because the gap is going, you know, we are all baby boomers, we're getting older, but the new generations that we are kind of coming up, we don't have enough population that will keep up our system, our wonderful social system that we all love. So we have to think on how are we going to make this population that comes behind us really productive. And it's about taking care about their health. But not only that, women take care about their elders. When a woman is sick, the Alzheimer population, I mean, the elderly population is untaken care of. When a woman is sick, the children sometimes are untaken care of. I'm perhaps exaggerating because we are balancing more our roles within the families, but women are a pivotal. Yeah,
You are
women
not
are
exaggerating.
pivotal to be able to maintain. No, but
like
seriously,
that.
they are the key to, I would say, a healthy and stable family, which is the basis of what our society is made of, and that's very important too.
Yeah. So, Catherine, when you're looking at your health inequalities, you know,
Yes.
I imagine this is an issue that comes up again and again.
Yeah, I must say migraines haven't come up very much, so we'll try to correct that. And I believe we are going to discuss neurological disease and strategy, so I think this initiative is actually quite good and quite timely because it would be important to talk about migraine there. I wanted to say that when we talk about conditions that affect mainly women and we talk about the impact on economy, we are always under-evaluating because big part of the what women's work is not accountable for, but it's
exactly.
there. And I think that was, and Patricia explained it so well, and I think this is really important. So we have all these huge numbers and then we have another huge numbers that are hidden because the work is not accountable at the economical levels. But I also want to say this because, well, you will correct me if I'm wrong, but this is a discussion that we are having when we are, you know, talking about all these kinds of things. I mean, women in Europe, the first cause of death is cardiovascular, more than men, more than cancer, more than men. And actually, when we look at the traditional risk factors for women, women smoke less, women drink less, women have less obesity. I'm not saying that women don't have all these conditions, but the ones that are considered the first risk factor, and even so, they die more of cardiovascular disease. Of course, we know that they are also underdiagnosed because at medical schools, well, people are not learning about the symptoms. But it's also true that diseases like migraine not being researched enough.
Yeah.
Exactly.
When they also have this kind of consequences.
Yeah.
I mean, at the end you die of cardiovascular disease, but you have a story. And was that story, you know, someone was looking at it? Someone was looking at that risk factor? And many times, unfortunately, not.
That's right, and you're absolutely right. There has to be more science to understand why women have more cervical dissections. I mean, the quality, you would say, perhaps, of the arteries is different, and that conditions how then the heart responds, reacts, and that's why it becomes a different type of cardiovascular risk factor. We have studied currently the typical male, you would say, risk factors. But there are others that have to do more with, and I'm getting maybe scientific or technical, which is the endothelium and the quality of how the artery is built and how it reacts, the adaptation that it has to flow. And that is different in women than men. And I am convinced that if we would study a little more all of this that you're mentioning, which are examples like migraine that actually condition how this flow of the arteries works, that conditions then how the heart beats and how it works, and then
Lena.
has problems.
Sorry, you wanted to say something there.
Well, I wanted to ask MEP Catherine to please help us to include migraine in this new neurological strategy plan, because we have a huge opportunity now to be seen. We are invisible. Migraine is invisible. We are hidden when we have an attack, when nobody sees us. We don't die because of it, so it's not important.
There is no
There's no data about that.
because
but
it has
related.
not been included in the medical. You said it. It has not been included in medical histories. I am not that sure, Elena. I am not that sure.
Okay, so maybe it has a role in death.
We need to know.
Yeah.
We need more
There's
research.
no
we need
data.
more
We need
data.
more research.
Yeah, we need more research on that. But we need to be considered, and we are now so disregarded, so overlooked. Nobody cares about migraine, and everybody thinks that this is a silly thing that we suffer, while it is so unbearable and conditioned, and fact that conditions our life so much.
Yeah,
That,
but you're right. There are kind of two types for you to understand this, because if you understand it, I think you will be more vocal about it. We have migraine as a disease when you don't even know about it. So imagine you've never had a migraine attack, but your genetic condition predisposes you for you to have a risk factor. It is known that even if you don't have attacks, if you have certain changes in your genetic composition, that already conditions migraine as a risk factor, cardiovascular risk factor. And then you have the attacks, which is when you find out that I actually have this disease. And both are equally important at a genetic level and scientific level.
Okay.
So it's interesting to know about this.
And I mean, when we were talking about the disease, I mean, it's so underdiagnosed. It's also misunderstood by people who suffer themselves. They don't necessarily think that they're suffering from migraine, even though if they're asked by a professional who knew about the disease to explain their headaches and the pattern of their headaches, they might say, well, you've got migraine. But, they don't. There are a lot of people who don't even know.
Yeah.
I think if you have more of a moderate migraine, then you just get used to it and you adapt your life and you think where to be and what to eat, and at different time points you need to adapt maybe even your hobbies and again the working life as we talked about. So I think you live with it from a young age, you sort of adapt to it, so maybe you don't, and maybe it's also not a good thing, right, to feel like a sufferer. So I agree. Also the patients, if it's not very severe, you can also as a patient underplay this, and I can only imagine, for men, because now we sit here, it's the International Women's Day is approaching. How easy is it for a man to admit that they have this
one very important thing
women's
that I don't want to forget is that pain is normalized. I mean, this constant feeling that I have a head and that this head is unbearable. And so what is the solution? What is the easy, simple solution that I have been taught? Take a pill. Take an analgesics. Why aren't you taking? And then we have the second problem, which is medication overuse. And we are not realizing the costs that has. People on daily ibuprofen, NSAIDs, anti-inflammatories, analgesics, I'm not going to say names. Some of these analgesics are opioids that are very addictive and create other problems. We are having stomach, kidney, liver problems. You cannot imagine how much iatrogenia is done with all of the overuse of acute medication that is being done, and people normalize it. It's normal to take 3 pills per day. People take 6 pills per day, mixes of coffee. You cannot imagine what people do to try to survive and deal with their lives, and that is not reasonable either, and it has high costs that are not even
recognized.
Recognized and taken care of.
Elena, sorry.
We do it because we need it. We need to take so many pills to be able to keep on moving on the day, because it's so unbearable. And you very well know that it's not only a headache, a very strong headache, an explosive headache. It's a whole process in our brain that lasts from 4 to 72 hours, in which we are unplugged and we cannot think, we cannot speak, we cannot do anything, we don't see, we hear. It's a whole very complex neurological situation. What I wanted to add is that we have just done a survey on women, and this is what why we are here on the Women's Week, and about the hormonal migraine. And there is a pattern in women, and we got 5,410 answers from women that have all the symptoms to be diagnosed as people with migraine, and they don't know it. They haven't been ever diagnosed. They haven't gone to a doctor because they think this is normal and it is something hormonal that goes in their mouth with them. But if they were well treated, they could live much, much better. But they don't know, and they don't recognize it as a hormonal migraine.
And as you say, there's also the stigma attached to the diagnosis itself that you might be resistant to as well. Katerina, you're also on the intergroup on brain health and neurological conditions. And you say that you haven't really heard migraine being mentioned really so much in that far.
No, I was talking about the strategy and what we are debating on a strategy for neurological diseases. And I must say, migraines are not an issue that comes up a lot. And so I think you probably need to do some work there. And what I wanted to tell you, I think Sant will have some initiative report also. We still don't know exactly the scope of it, if it's going to be neurological diseases, but it will have neurological diseases. And what I can tell you is that it would be good if you knock on all doors. Because my experience has been that, Sant Committee has 1 year, you know, it's a new committee. But I think it's been possible to make bridges with several groups to make aware of certain situations. And that has been good. And so I think there's room here to put the Parliament also, you know, saying the Commission that migraines need to be there, and we need research, and we need awareness, and we need also training for health professionals and everything. So I think there's room for that, and I really encourage you to knock on every door. I will do my part also, and I know you do. I know I don't need to tell you what to do.
Your door.
But yeah, I think that is a path that can be done here. I'm going to tell you also very clearly that I'm really concerned about budget for all of this. I mean, Patricia was telling we don't have calls for research on migraine, and the thing is, right now we are discussing the budget at the European level. And the EU for Health, that is really important for all of this, it's actually, we don't know what's going to happen with the EU for Health. And so we have this competitiveness fund, so health is there. And, you know, health is not very good with competitiveness, because in the end, if we really succeed and prevent disease, it will be
more expensive.
No, at the microeconomicals level, it's not a good business. What we want to do is not a good business, because we want to prevent disease. We don't want to sell stuff. We want to prevent disease. So we need to protect, I believe, the budget for health programs and for health research in European Union. And so also for that, I think it will need to. We need to be strong advocates for the idea that we need public strategy and public investment in health and in health research.
Especially, I mean, for example, as a neurologist, I would say that the two more prevalent conditions in neurology that's disabling affect more women than men, and they are highly more prevalent: Alzheimer and migraine. And we have to take care, of course, of both. The difference is that if you don't take care of migraine, in my mind, all your productivity as a society goes down. And I don't see how you it's not seen that by not investing in this brain health during the most productive years of 20% of women of Europe cannot positively impact health in general. I mean,
yes, of course.
Productivity and money in general. You know,
it's long term is fundamental.
And it's easy to understand that the healthier Europe we have, the stronger Europe will be.
Yes,
we need health. I don't know why many times we work with economics or I don't know, many other things. But if you don't have a healthy population, and you don't have a population, health is the most important thing. Without health, there is no life. And without brain, there is no health either. So we need a healthy brain too.
Yeah.
I'm afraid we're now coming to the end of our session. It's been very, very interesting. But before I close this discussion, could you just say, each of you, what is the one thing that you would like to see change at an EU level that would make a big difference to the migraine community? Lynn?
Yes, I would definitely say to have migraine included in the neurological health strategy, for sure.
I think
Elena?
so too. I think so too. And I think support, respect, and inclusion in the programs, in the policy agenda programs. We need migraine to be
recognition
and
of the
recognition
disease.
of the disease. Yes.
Patricia?
I agree. I agree. For me, as if I have to be more specific, I would focus on science. Science leads the way, and then educate. And the only way of doing that is by getting migraine into the health agenda. Recognition again.
Recognition, education, research.
Yes.
Yeah.
Better pathways. Katerina?
Let's put it in the health strategy and also on Horizon.
Horizon
So
Europe.
we
yeah.
know Horizon Europe, so we know that we have this research, and I think, that's what we need to do.
Thank you.
Let's do it.
Let's do it. Yeah. Thank you.
Thank you.
So I'd like to thank you all very much again. I think it's been a great debate. I hope those of you who have been following live have also enjoyed it. And I hope that this is no longer going to be an under-recognised condition, and it's recognised as more than just a headache. Thank you very much.